right? Stop what you're doing. Put down your biscuit. Because the government has just decided to blow up the NHS, not literally, obviously, but structurally, which depending on who you ask, might actually be wise. Welcome back to UK Daily Coffee, where we mainline British politics straight into your veins. No milk, no sugar, just the raw, unfiltered chaos of Westminster. And today? Today we got a proper one. Prime Minister Keir Starmer has announced that the government will abolish NHS England within the next 2 years, pulling its functions directly under the Health Ministry, RAND, all in the name of bringing the NHS, quote, back into democratic control. Sounds lovely, doesn't it? Democratic control. Very wholesome, very responsible. The kind of phrase that sounds brilliant in a speech and absolutely terrifying to anyone who has to actually make it happen. Let's rewind. NHS England is the body that operates separately from the Department of Health and Social Care, responsible for delivering healthcare in England. It was formed in 2012 under the coalition government. ITV News. So essentially, some politicians in 2012 said, right, let's create a massive independent organization to run the NHS so ministers don't have to deal with the daily nightmare of it. And now, 13 years later, a different set of politicians is saying, actually, bring it back. We'll deal with it. That is the British government's version of a fresh start. Return to sender. No thanks. We want the chaos back, please. Now here's where it gets spicy. Just 6 weeks before the announcement, Health Secretary Wes Streeting made clear he had no plans to abolish NHS England, saying he didn't want to spend taxpayers' money just changing some job titles, TUPing over staff and changing some email addresses without making a real difference to patients. Institute for Government, 6 weeks. That's not a policy reversal. That's a man having a very expensive change of heart in public. 1 minute he's saying it's a waste of money. The next he's at the dispatch box abolishing the biggest quango on the planet. Whatever Wes Streeting had for breakfast between those 6 weeks, I want it. That is decisive energy. So what's actually happening? Let's break this down without the spin. Health Secretary Wes Streeting told MPs that across NHS England and the Department of Health and Social Care combined, overall headcount would be reduced by 50%, with NHS England employing around 15,000 staff and the department around 3,300, meaning roughly 9,000 jobs are set to go. ITV News, 9,000 jobs. Gone. In the name of cutting bureaucracy and saving money, with the government aiming to save around £400 million annually. The UK CAT people. And look, nobody loves a pointless layer of management. Nobody is sat at home thinking, you know what the NHS needs? More people in meetings who don't see patients. But here's the thing. It's not quite as simple as just deleting a spreadsheet and calling it efficiency. NHS England employs senior doctors and other healthcare workers who contribute practical knowledge from the NHS frontline into policy roles, and the loss of that clinical expertise is probably the largest risk of the abolition. The conversation. So yes, you're cutting bureaucracy. But you might also be accidentally deleting the people who actually understand how hospitals work. That's not trimming the fat. That's a bit closer to removing a kidney and calling it a diet. But wait, there's more. Because abolishing NHS England doesn't just mean shuffling some org charts. It requires a new definition of ministers' relations with the NHS. Without NHS England acting as a buffer, the buck will now well and truly stop with the Health Secretary. Institute for Government, which means every botched waiting list, every A&E crisis, every cancelled appointment that lands directly on Wes Streeting's desk. Permanently. With the nation watching. Congratulations, Wes. You wanted democratic control. You've got it. Hope you enjoy being personally responsible for the entire health of 55 million people. Now, predictably, the doctors are not thrilled. The British Medical Association, the BMA, has been locked in a brutal standoff with this government for months. The BMA called the abolition a high-stakes move, warning it must not become a distraction from dealing with a historic workforce crisis, bringing down waiting lists, and restoring the family doctor. BMA, translation. We cautiously acknowledge this could work, but we've seen what NHS reorganizations do up close, and we are watching you very carefully. That is doctor speak, for we do not trust you as far as we can throw a stethoscope. And it's not just cautious concern. BMA public health doctors raise an emergency motion warning that the sudden abolition risks worsening population health and deepening health inequalities through a potential large-scale loss of public health specialists, posts, and training. BMA, less public health expertise in the system, right as the NHS is already on its knees. Brilliant timing. That's like canceling the fire brigade training program because the building already has a sprinkler system. Meanwhile, in the background of all this restructuring chaos, resident doctors in England have been on strike demanding fair pay in NHS jobs, with workers warning that their real incomes remain below 2008 levels. So where does this leave us? Here's the honest summary. The government is betting enormous political capital on a reorganization that its own health secretary called pointless 6 weeks before announcing it. The abolition of NHS England, compared to truly decentralized health systems elsewhere in Europe, is actually a relatively minor change. Sweden has genuinely decentralized healthcare. We're just moving the same furniture into a different room and calling it a revolution. That's not necessarily wrong. Sometimes the furniture does need moving, but let's not kid ourselves that this is the NHS transformation the country has been waiting for. The real test isn't the announcement. It's what happens in 2 years when the dust settles, the jobs have gone, and the waiting lists are still there. Because patients don't care who signs the forms. They care whether they can see a GP. They care whether the ambulance shows up. They care whether someone who trained for a decade to be a doctor is still in this country, working in the NHS, and not burned out in Brisbane. Starmer said the NHS should be at the heart of government where it belongs. Fine. Great. But the heart of government isn't a warm, caring place. It's a pressure cooker of political decisions, budget cycles, and media headlines. The NHS doesn't need to be closer to politics. It needs to be closer to patients. Those are two very different things, and the gap between them is exactly where this policy will succeed or fail. That's your UK Daily Coffee Fix for today. Ground fresh, served hot, and slightly bitter, just like the state of British healthcare. If this video got your brain going, smash that like button and subscribe so you never miss a drop. We're posting multiple times a day, so there's always something new on the channel. Tap the bell so YouTube actually tells you when we're live. And drop your take in the comments. Do you think abolishing NHS England fixes anything? Or is this just rearranging deck chairs on a very expensive, very underfunded ship? I'll see you in the next one.